45 million migrant workers. The world stunned to see tens of thousands of people locked out after the lockdown, these massive crowds, no social distancing, walking back to their villages, desperately looking for food. What happened there? Take me beyond the pictures and images that we saw.
The migrant workers is a problem unique to India. So we've got two crises here. We've got the global pandemic, just like you guys. And then we've got 45 million, just want to have that number sink in. 45 million men and women who live in the villages but work in the cities. And in the cities, they have no permanent home. And when the lockdown was enforced to stave off the pandemic, and we're now in the third phase of the world's largest lockdown, we had a panic-stricken exodus from the cities of these people walking hundreds of kilometers, hundreds of miles to their villages' home. I met the family, the widow of a man who walked about 300 kilometers home and died about 80 kilometers before he reached home. He made a last phone call home to his sister saying, "Can you come and get me?" And by the time they were able to reach him, it was simply too late. I have walked with workers week after week after week, and this is the one issue, Tamron, on which the government could not anticipate that we'd be looking at this mass exodus of people. Some are calling it the largest mass movement since India's partition in 1947. So for us, it's become fighting the pandemic on the one hand and fighting this emerging humanitarian crisis on the other.
You know, I'm watching you now with your mask on, knowing that you are required. It's mandatory if you're outside to wear a mask there. Here, still in the States, again, compare contrast, it's optional. There is a dangerous stigma there about people who contract coronavirus. We've seen the images of workers being sprayed with disinfectant amidst this fear. Tell me about how that stigma is now one of danger to some people.
We've seen doctors at the front line actually pelted with stones in some instances. We have seen neighborhood societies saying, "We don't want you here." We've seen people like myself, journalists, I've been told by neighbors like, "Listen, can you be careful? We're a little uncomfortable having you around." I managed to fight that off, but there are nurses and there are doctors who are deeply hurt, egregiously assaulted and feel abused, that after their frontline service, they're actually being treated like pariahs. And we are unfortunately seeing a deep stigmatization, Tamron, a stigmatization so deep that even where testing kits are available, a lot of times people aren't volunteering to go and test because they're too scared of the stigma, of the label, of the quarantine that they may have to go through, of the sticker that may be pasted outside their home to indicate to the rest of the neighborhood that this is possibly a corona positive patient.
Which brings me to the question, there are 1.3 billion people. There have been only 1,000 corona deaths confirmed. When you tell me that people feel a stigma to even get tested, how could we ever possibly truly know how many people died of coronavirus there or were infected?
There is a sense, Tamron, that India has been a mysterious outlier. One, the lockdown of 1.3 billion people did help. It has helped, slow down the pace of infection. It has helped flatten the curve. But there is no dispute over the fact that even if we're under testing and even if we're under reporting, our hospitals are not overwhelmed with ill patients showing the symptoms of coronavirus, at least not yet. There are some theories for this. One theory is we're a younger country than the other countries that have been hit by the coronavirus. Our demographics are in our favor. The other theory is that we have been exposed to these viruses before, what's called zoonotic viruses. We have had exposure of variations of the coronavirus before, and so maybe we're just immune. Science does not have a clear answer. We've been trying to understand it ourselves, and to that point, people like me have been arguing that the humanitarian and the economic crisis that we're looking at might actually be greater than the threat of the coronavirus. And I'm beginning to feel that the lockdown is hurting more than it's helping, because it's really our most impoverished, our poorest people, millions of poor children who don't have access to internet, who don't have access to Wi-Fi, who are being edged out of the school system, millions of poor Indians who only have access to the public health system, may not have COVID, but may have tuberculosis, may have cancer, may have kidney disease. They're being turned away from public hospitals, and we're seeing fatalities in that space. So it's beginning to really worry me that in fighting this pandemic, are we on a parallel track creating a crisis that may be much larger than the fatalities of the pandemic are suggesting here thus far?